At this point, I'd like to acknowledge the presence of the EFA dignitaries, EFA Chairman Tsutomu Manari, and let's give a round of applause. Yes. Onegai shimasu. And FEA Chinese Taiwan Chairman Richard Cheng and his wife, Dr. Joyce Fang. Good morning, and thank you for gracing us with your presence. Now, it's on to the first session for today. As mentioned by Kai earlier, we will be doing a deep dive into 4 vital sectors and hear what efforts most of these representatives and the thought leadership has been doing in their organizations in order to champion the 3 factors we mentioned earlier. For our first session, let me introduce our session speaker, the Undersecretary Emmy Lisa Perez Chong of the Department of Health. Undersecretary Emmy is the cluster lead of the Health Regulations and Facility Development Cluster. She's also the Chief Information Officer of the Department of Health. She's recognized for her leadership in advancing healthcare initiatives in the Philippines with a wealth of experience in the medical field. She plays a pivotal role in shaping policies and programs that improve health outcomes and access to quality service for Filipinos. Ladies and gentlemen, a warm round of applause and welcome to Undersecretary Emmy Lisa Perez Chong.
Good morning po sa inyong lahat. I would like to read the speech that my staff provided for. Actually, he gave me like a 4-page speech, and I told him, that's too long. People will not listen to me anymore. So I preferred the 1-pager speech, and here it goes. Magandang umaga po, FINEX attendees. I'm thrilled to be at the 56th FINEX conference, where our theme is Empower Progress, Inspire Change, Transformational Growth through Sustainability, Diversity, and Digitalization. Let's start with collaboration. In healthcare, partnership between government and private enterprise drives innovation, from vaccines to telemedicine. However, sustainable and digital healthcare must benefit everyone, especially underserved communities facing barriers to access. We must ensure that healthcare is equitable and accessible, not just the privileged. Kung seryoso tayo sa diversity at inclusivity, kailangan natin tiyakin na ang healthcare services ay naiayon sa kultura at pangangailangan ng bawat komunidad. Hindi pwedeng one size fits all ang ating mga programa. Iba't iba ang pangangailangan ng mga grupo, lalo na pagdating sa health services. This is about making healthcare equitable and accessible for all. Ang problema, kadalasan ang mga communities na mas nangangailangan ng tulong ay sila rin ang pinakamalaking may barrier sa access. It's our responsibility to make sure that sustainable and digital healthcare are reaching these groups. Hindi lang ito tungkol sa mayayaman or may access sa technology. We also can't overlook data analytics, which fuels our digital healthcare revolution. It helps improve patient outcomes, optimize operations, and predict health trends, ultimately leading to more efficient and sustainable healthcare system. As we continue this conference, I encourage everyone to think about how to be game changers in our fields. Let's work together to create a future where every Filipino is healthier and more empowered. Dahil po, sa bagong Pilipinas, bawat buhay mahalaga. Thank you and good morning. I am Yusek Molly, that's my nickname po, baka magulat kayo. I'm Yusek Molly Perez Chong of the Department of Health. Thank you very much.
Thank you, Yusek Molly, for truly fostering public-private partnerships in such a vital area of development, especially with the Department of Health platform and your advocacies. We're going to look forward to hearing more of you at the panel discussion. Now, for this panel, let me introduce our panelists today. We have three joining us. The first is Mr. Jaime Ismael, President and CEO of Healthway Philippines. Let's give him a round of applause. The second is Ms. June Shirley Cabal Revilla, the President and CEO of MWell. And the third is Mr. Joselito Diga, the SVP for Finance of Unilab Incorporated. All panelists will be given 5 minutes for their introductory messages, and then we'll proceed with the discourse. Thank you.
Good morning, ladies and gentlemen, and thank you for the opportunity to speak to you this morning on how we push for sustainability, diversity, and technology at Healthway Medical Network. AC Health is the healthcare arm of Ayala Corporation, as was shown earlier in the presentation of Jaime Augusto. We have deliberately built a diverse portfolio where synergies make healthcare delivery seamless and patient-centered or focused. Our pharmaceutical pillar focuses on ensuring the availability of quality generics through our Generica drugstores and more recently, St. Joseph Drug. The retail arm is supported by our importation and distribution units, namely IE Medica and MedEthics. Not only does our pharma pillar make medications more affordable for consumers, but they are also key in filling the medication requirements of our clinics and hospitals group. Healthway Medical Network, which I head, is the clinical and hospitality pillar of AC Health. With over 220 corporate clinics across the entire Philippines, 16 multi-specialty centers, 5 general hospitals, and 1 super specialty hospital. We are committed to providing our patients a seamless journey through the care pathway, and this is supported by our digital health pillar, which is Consulta MD, a joint venture company between AC Health and Globe Telecom. Consulta MD is a super app that provides teleconsultations to patients, allowing us to reach even the farthest barrio in the country. Allow me to zoom into Healthway Medical Network and how we resonate deeply with AC Health's mission. We are strong believers in making healthcare affordable, accessible, and of the highest quality. Okay. Accessibility is a key feature of our network, with clinics and hospitals scattered across Metro Manila, Northern Luzon, Southern Luzon, and the Visayas and Mindanao area. We are able to serve thousands of patients every single day because of this network. Moreover, we are also able to provide end-to-end healthcare services, from primary to specialty care, and from corporate clinics to full-service hospitals. We are also proud to have built the first ever dedicated cancer care hospital in the country, located in Arca South, Taguig, one of the estates of Ayala Land, inaugurated in November 2023 by President Marcos himself. The Cancer Care Hospital makes cancer care holistic and within reach for the many Filipinos affected by this disease, which is the number 3 cause of mortality in the Philippines. Knowing that financial barriers also hinder wait, yeah, sorry. Also hinder patients from getting the care that they need, Healthway has pursued strategic partnerships with a variety of stakeholders to help ease this burden. We have partnered with local government units, the DSWD, HMOs, patient groups such as I Can Serve, and NGOs such as the Philippine Red Cross to provide financial assistance to patients who are in need of medical care. We have also partnered with multinational pharmaceutical companies such as Roche, Novartis, MSD, and AstraZeneca for their patient access programs. And these are programs that significantly lower the cost of chemotherapy medications for our patients. Our partnership with Siemens Healthineers has also allowed us to equip our hospitals with state-of-the-art machines while keeping the costs low. In fact, our PET CT scan at the Healthway Cancer Care Hospital can go as low as 48,000, almost half of the cost of what other hospitals would charge. We are also launching our affordable HMN Care Card, which provides unlimited primary care consultation for 1 year, free flu vaccination, or annual physical exam, as well as discounts to many services, as well as inclusive of an insurance provision. By introducing this product, we hope to achieve the underserved segment in the Philippines who do not have HMO coverage. And that's only for 999 pesos for 1 year. All aligned with our affordability initiative. At HMN, we strive to ensure the highest quality of care for our patients. Our mantra is care beyond cure, seeing patients as more than just numbers or statistics. Our approach to healthcare is humanized, which means we treat our patients as people, as human beings to be cared for and nurtured. Our proprietary integrated practice units, or which we call the Connected Care Circles, is a testament to how we care for patients throughout their journey, from prevention all the way to treatment and rehabilitation. Centered on 4 main disease groups, namely cancer, hypertension and cardiovascular disease, diabetes and chronic kidney disease, and women's health, the Connected Care Circles ensures a holistic and multidisciplinary approach to care delivery. Evidence-based clinical pathways vetted by our in-house team of experts ensures that patients receive the best standard of care for their illnesses, leading to better patient outcomes and satisfaction. We also have partnerships with well-known international healthcare facilities like the National Cancer Center of Singapore and the City of Hope in Los Angeles, a well-known cancer institution in the West Coast that allows us access to global best practices in the areas of second opinion consultations, as well as tumor board discussions to better diagnose and determine the kind of treatment that a patient needs. Beyond patient care, we have applied care beyond cure to the way we do business. We have taken significant steps towards sustainability through a switch to 100% renewable energy across our hospitals in collaboration with AC Energy. Using wind, solar, and geothermal power, we are able to reduce our carbon footprint or emissions by about 68,360 tons, or the equivalent of that absorbed by 3.1 million trees in 1 year. We are also ED certified, which means that our Healthway Cancer Hospital was designed to reduce energy, water, and material costs. And this was in line with the IFC social bond that actually funded the bulk of our cancer hospital. Moreover, we have taken steps to reducing solid waste through IWMI, which has a waste to resource program. Healthway Medical Network is also a strong advocate for inclusivity, especially cancer inclusivity. We have been active partners with the Publicis Group, an international organization that initiated the Working with Cancer Pledge, an initiative that encourages employers to make the workplace more inclusive for cancer patients. As its local partners, we've been able to onboard companies like Globe Telecom, Ayala Land, AC Mobility, and AC Energy, as well as Asticom, ensuring that employees of these organizations have access to the support that they need at work. We also support diversity initiatives through partnerships with various universities, including universities like with healthcare provisions like UARM, UP Manila, FEU, and Pamantasan ng Lungsod ng Maynila. These partnerships allow us to offer scholarship opportunities to underprivileged but deserving students, internship and exposure opportunities for allied health professionals in our clinics, faculty development and training prospects, leadership summits, and corporate office exposure. Through these efforts, we make our workplace more diverse, promoting intergenerational collaboration and equality in terms of gender and faith, making us more receptive to new ideas and ways of doing things. Finally, we are embracing technology and digitalization. Through various initiatives across the network. The colossal task of integrating our electronic medical records across all clinics and hospitals is being accomplished through the use of a platform called Arcus Air. And once realized, we will be probably the first network in the country with a fully integrated medical record system that is interconnected with our ERP and other digital systems and applications on healthcare, allowing continuity of care for patients and improvement of patient outcomes. Analytics can also be enabled by investing in this platform that will allow us to be more precise in terms of developing programs, clinical programs that will best serve the needs of patients. We've also been piloting the use of artificial intelligence through a software called Cure AI, which allows us a more accurate diagnosis of potential lung cancer cases, no? By using a simple X-ray images and applying AI to actually identify and diagnose if a patient has lung cancer. We're piloting this in our hospitals, and at the same time, we're also increasing patient touch points through Consulta MD, which is the platform of the super app that I mentioned earlier, as well as our own HMN contact center that allows us to actually provide access to all of those patients and reduce the drop calls, reduce the pain points that every patient normally goes through. The prime example of the intersection of affordability, accessibility, and quality, as well as sustainability, diversity, and technology, is the Healthway Cancer Care Hospital. We have taken great steps to ensure that care beyond cure is apparent in every corner of the hospital, from the service given to patients, to the way the structure is built, to the way we continue to do business. We are proud of this achievement and invite all of you to come and visit us as we also offer non-cancer services like executive checkups and other clinical services to see how we can redefine the way healthcare is provided in the country. With that, I'd like to thank you all for the opportunity to speak. Thank you.
Thank you very much, Jaime Ismail, President and CEO of Healthway Philippines. Now we'd like to call on Sheikh Abal Revilla, President and CEO of MWell.
Hello, good morning, everyone. Okay, so we are MWell. We are the digital arm, healthcare arm of the Metro Pacific Investments Corporation Group, and we're also affiliated with the Metro Pacific Health. What we do for MWell is to really push for health and wellness, to make it affordable, available, accessible to anyone, anywhere, anytime. So with the many things that we're actually doing, we're complementary with Mr. Jaime Pascual of AC Health. Friend tayo, at saka si Mr. Lito Diga. Friend din tayo. So I think for here, what we really wanted to show is we are aligned with AC Health in making health and wellness affordable. So in respect of our health passes, we actually offer 399 pesos per teleconsult with a 20,000 insurance for the ordinary Filipino. Because I'm also the Chief Finance, Sustainability, and Risk Officer of MPIC, we actually make sure that all the things that we do in the group are aligned with our sustainability agenda. So for MWell, we are hinged on UN SDG number 3, which is good health and well-being. This is something that we really are very passionate about because, as we all know, healthy people enable healthy economy and enable also the preservation and conservation of a healthy planet. So what we've actually done at MWell was to address the pain points of our Philippine healthcare landscape. I don't know if you're aware that in terms of statistics, there's 6 out of 10 Filipinos who actually die without seeing any doctor or having any consultation whatsoever. Ma'am, tama po ba? O, tama. Buti na lang tama yung sinasabi ko. Yes. And then in respect of our availability of doctors, the World Health Organization requires 1 to 10,000 people, no? But for the Philippines, we have 1 to 26,000 for the urban areas. And in the remote areas, 1 to 40,000. And in terms of our mental health, at MWell, we call it mind health kasi ang mental dito sa Pilipinas, may tililing ang connotation. So in terms of the psychologists and psychiatrists, 1 out of 100,000. So which is really, really an issue. And if you recall, Mr. Lito, partner tayo, di ba? So every time we go to remote areas, to service IB communities, sa mga dumagats in Quezon, mga remote areas in Tawi-Tawi, Basilan, Turtle Islands, we ask for the help of Unilab. So they give out naman mga medicines. So these are the things that we actually do together with partners. Next, as I mentioned, we've reached remote communities. We've also partnered with many LGUs and the soldiers, no, in their duty. So we have partnered with the AFP because we have this clinic in a bag called ML on the Go, where even those communities that are in off-grid areas na walang electricity, we provide a foldable panel and a battery pack so that they're able to call doctors 24/7 and access health and wellness. Also, we've made nga the offerings of ML very, very affordable because most of our Filipino kababayans are daily wage earners. They need to be healthy in order for them to go out in the street to earn a living for their families to put food on their table. So if they're not healthy, wala silang kikitain araw-araw. So this is really our push. So we've reached mga market vendors, mga toda, mga tricycle drivers, the ones who actually deliver your orders at Lazada, Shopee, like that. And what we've also done was to partner with Smart, wherein some of those Filipinos who have no smartphones and no e-wallets yet are able to reach doctors via the sari-sari stores. So we've actually transformed our mom and pop stores into extended clinics na rin, so that the manangs will be able to help the Filipinos who have no digital or smartphones, etc., to reach or talk to doctors. And then, before Secretary Toots Ople passed away, we actually inked a partnership with the DMW, that's the Department of Migrant Workers, for our OFWs. Now, we actually service 200,000 OFWs globally who badly need to talk to Filipino doctors naman in respect of their healthcare needs. In terms of innovations, I'm sure you've looked at our booth outside, and Tita Flor Tariela, thank you for ordering our rings. We've actually put in some preventive health measures for Filipinos to be really healthy. And given the pandemic that happened in 2000, no, which sort of really pushed our hospitals to the brink of collapse or something because of the doctors and the nurses, what we've actually done was to push for preventive health, thus our wearables. So now we have our Emerald watches, which is about cost about 2,499. Very, very affordable for most Filipinos, ordinary Filipinos, versus the Apple Watch. Kasi yung Apple Watch, mga 30,000, no? Afford nyo, pero yung ordinary Filipino, hindi. So, 2,499. Who says that a woman can only wear one watch? You can have any smart gadgets or wearables, Fitbit, Garmin, Apple Health, Samsung, ano pa yun, mga whatsoever. You can actually connect it with the M-Wellness score, and it'll give you your health and wellness score, which is different when you only have a gadget because it just gives us statistics, right? Steps, etc. But there you will get an overall wellness score. And then we also have our wearables, our rings, M-Well rings. So when people ask me, what colors do you have? I say 3. So marketing na rin. The difference between the ring and the watches is that the rings actually provide the quality of sleep. Kasi diba, the watches would say, oh, you slept for 5 hours. But in terms of the quality of your sleep, you don't get it from your watches. You only get it from your ring because it gives you the average, ay, Bumbaylina, thank you. The average heart rate variability, your oxygen saturation, your deep sleep, REM, etc. So that's a difference. Our M-Well rings cost about 8,999, but if you buy 2, there's a promo for 30% off. The Aura rings actually cost $600 US. The Samsung ring, when they make it available, I think publicly is about $400 US. So ours is 8,999, and then pag dalawa Tita Flor ang binili mo, 30% off. The watch, I think there's a 10%, 2,499. The ring po. Nililuto niyo ako, ha? So wait, so the wellness score gives you an overall score on a daily basis. What we've actually done was to also gamify this. So in MPIC, for example, we've enrolled in a leadership board where everyone gets ranked according to the score, the steps, etc. And our HR incentivizes the top 10 high-scoring, employees, which is good because at the end of the day, after 2 years of taking a look at how it works for us, our medical costs have actually decreased by 45%. Yeah, and absenteeism also by 25%, etc. So there are many, many metrics. Kasi Mr. Lito, finance tayo, di ba? Gusto natin may KPIs. Very measurable. The other thing that we also have here is the mind health. So there's a mind health score. When you accomplish the 6 questions by the World Health Organization, you get your mind health score. This one is very popular with universities, especially because the kids now have a very low tolerance for pressure, ganyan, stress. So the universities actually want to get the mind health score of their students early on, so that the bottom students who actually have the lowest score, they proactively ask already, "Uy, kamusta ka na?" bago tumalon sa building. So I've talked about this. There are many, many features, and it's really good for you to play around with the app. And I will tell you that this is very, very easy to maneuver and to navigate. It's very intuitive, because when we designed this, we said that this has to be very friendly to our lolas, and that my 5-year-old daughter at that time would be able to navigate it without asking me. Just as a little kwento, my daughter got sick like a month ago, and then kasi the yayas would list the temperature, the oxygen saturation. What we did was to let her wear her ring on a daily basis. And now she's very conscious. She'll say, "I have to sleep early because I will get a low score tomorrow." My 8-year-old daughter, she's very competitive with her health score. What we've also done at MWell was to create a digital gateway for the smaller clinics not within our system. So here, they're able to do bookings and scheduling. The users can do bookings and scheduling 24/7. And we've also made available a portal at their end, so they're able to also get the schedules, etc., of their patients. This is quite good because before, some users will still have to call and text, etc. And then the clinics are limited to the opening hours of their clinics, right? Now they can get booking 24/7. This one naman is for our hospitals and our bigger clinics. We have CMS, and then the MLMD for our doctors. So what we've also done was to make available an EMR and a medical system for the doctors. So they're able to service their patients wherever they are, in the car, because there's a mobile app for it, and wherever they are if they're traveling, for example. Because one of the inputs of the Metro Pacific Health Group, our hospitals, is that the hospitals' revenues actually go down when there's a huge amount of doctors going out of the country for their summit, etc. So now what we've done was to expand the reach of the doctors so that they're able to service their patients wherever they are. So this is something that we're actually doing with the Metro Pacific Health Hospitals. We have about 26 hospitals nationwide right now, including Makati Med, Asian Hospital, Cardinal Santos, Davao Doctors, etc. And we're developing the digital front door for them. And we're also digitalizing them. We are very proud of this innovation because it provides a digital health ID for all. So it empowers everyone because now it's all paper, right? So like my husband, when he does his executive checkup, we have to like bring lots of folders in a box, etc. Now everything is going to be at your phone. And someday when all of our Metro Pacific Health hospitals are already enabled, so when we go there and for appointments or admissions, etc., they'll just have to scan the QR code, your digital ID. You will have to give your consent, of course, and then we won't have to write 10 pages of who I am, what my whatever is, and you'll forget. The ID will give you a summary of your medical condition already, which is very, very good for us in terms of patient experience. So what we've essentially done was to really expand the reach of our doctors and our Metro Pacific Health Group. So we not only service the geographic area of where our hospitals are, we're also able to reach our OFWs, who are very key to our economy because they provide, the number 2 of our GDP, diba? So that's our contribution in terms of the health of our country. Thank you very much.
Thank you very much, Sheikh Cabal Revilla, President and CEO of MWell. Our final panelist who will be giving his presentation is Mr. Lito Diga, SVP for Finance of Unilab Incorporated.
Good morning, everyone. It's indeed a privilege to be in such distinguished company. Sabi ko nga kay Jeng, no, bihira ako makapag-attend ng FINEX, but I couldn't miss this particular session given the theme is really inspiring. No? It's empowering change, empowering progress, and inspiring change. And after our first two speakers on health, I wanted just to talk a little bit about a topic that's very crucial and essential. I think in the overall theme of sustainability and making sure that our country is prepared to take on the challenges and opportunities of the future. So for this morning, I wanted to just talk a little bit about the overall challenge, and Yusek Molly, I think, set the tone in terms of the message that health is vital for the country's progress and the future. And at the same time, it is a daunting challenge which requires partnerships, not just of government, but also the private sector and many other organizations. So what I wanted to talk about today is this challenge of universal health care and what it means for us in the private sector in particular, and what role we might be able to play in this particular area. Okay. Just to give a bit of background, so last decade we've seen significant initiatives on the part of government to set the framework for universal health care, culminating in 2019 when the President signed the Universal Health Care Law, which is a landmark law mandating coverage, no, of all Filipinos under an appropriate and funded healthcare program. I think this is crucial indeed to make healthcare a priority. No? And today I just wanted to highlight some of the significant aspects and challenges around universal healthcare as envisioned and as mandated in our country. So universal healthcare, as you said, talks about making healthcare accessible, okay, and available to all Filipinos. But indeed, where are we today vis-a-vis this particular vision of universal coverage? No? So specifically, when we look at the challenge, it's around three areas: coverage, access, and risk. Okay. All of these are important to ensure that healthcare not just isn't just a vision, but becomes a reality for as many Filipinos as possible. No? Okay. And when we talk about coverage, we refer to how many Filipinos are actually enrolled in our universal healthcare program. So right now, in terms of numbers, Yusek, I hope the numbers are correct. We got it from government. We have 92 million Filipinos out of our population of around 118 that are currently covered by PhilHealth. No? So that's around 83% of our total population. So in gross numbers, it looks like a huge number of Filipinos are covered. And so that's a good start. But then coverage is just the start of the discussion. The other access, the other aspect that needs to be looked at is access. what are the benefits and how can Filipinos access these benefits? Okay. So access under the universal health care covers not just the curative, which I am sick, therefore I need medication to help me get well, or medical care, but it encompasses the whole spectrum from prevention to treatment to promoting proper healthcare behavior, like was shared by Michelle, with all the wearables. I'm a fan also of wearables, so I will check out the Ring for sleep. Kailangan natin yan. All the way to palliative care. Okay? So this is where, in terms of making the program real for as many Filipinos, PhilHealth has, and with the DOH, has spearheaded the Consulta, PhilHealth Consulta program, exacto, same as the initiative of Ayala Health. Now, the Consulta program is different in that it covers outpatient care. Meaning to say, how do we promote health for Filipinos outside of the hospitals, even before they have to be in the hospital for a more serious condition. Okay. Now, this initially, PhilHealth said that we have to cover, at this point, 13 diagnostic. So outpatient consultation, 13 diagnostic areas with 21 medicines. So that's the pilot, that's the initial coverage. And right now, PhilHealth is doing a couple of proof of concept initiatives across the country to look at how to make this program real. So the reality is, on the third aspect, which is on risk, and here this is quite relevant for us as financial executives, the whole aspect of risk management. So there are two aspects to it. As families and individuals, okay, time and time again, I think we've seen the impact, the negative impact of an unexpected illness in the family. Okay. Many people I know have suffered greatly. If there's a member of the family who has a really serious disease, it causes financial hardship for many Filipinos. Okay. And it's also relevant from a provider perspective. Okay. If we're in the area of HMO, providing coverage and so on, then we have to deal with how do we cover our patient base, our customers. And PhilHealth has that big challenge as well, because given the limited budgets, and we talk about budgetary constraints, there is only so much resources that can go around. So these, whatever available, it's important to be able to allocate this well within the target coverage area of as many Filipinos as possible. Unfortunately, the reality is, well, the good news is that in terms of health spending, this is coming from a study, a 30-year study that was conducted to look at how much do we allocate for health spending. So the good news is that in terms of coverage, it has grown significantly over the last 30 years with an average of almost 6% growth per annum. Okay, the question is this enough? Does this make a difference in terms of health quality and outcomes for our country? Okay. On a per capita basis, we are currently spending about 10,000 pesos per individual. Okay, that, given in today's inflation, and everyone knows how much it costs to consult with doctors and avail of medical services, this amount seems a bit short. Okay? But it is a reality right now that we face in terms of getting coverage and financial access to proper health care. Benchmarking, we spend around 6% of our GDP on health, which actually is quite interesting because we are, compared to our peers in ASEAN, spending above the norm. So in that respect, we seem to be a little bit ahead of our peers. No? But the reality is about half of that spend is out of pocket. Okay. Now the target for government, if we look at equitable access to healthcare, the target is that 80% of healthcare spending has to be covered by some form of national insurance. For example, we talk about coverage in the UK, Japan, or some of the other developed countries, or in Singapore and ASEAN. No? Thailand is a particular case in point. The target is 80% coverage. We are nowhere near that benchmark. Okay? Right now, it's about half out of pocket, okay? Around close to 40% government, okay? Of which 10% comes from PhilHealth and the rest coming from DOH and other local government spending. Okay. So there's still a long way to go as far as making universal healthcare a reality, no, for us, no? Particularly when it comes to how much healthcare is dependent on the family's budget. Okay. Right. So here's some benchmark numbers. No? So as I said, in terms of share of GDP, we are doing quite well compared to our peers in ASEAN. But in terms of absolute amount available for spending, we are way, way behind. No? And that is a challenge for us right now. Okay, so what are some of the things that we can do as far as health financing is concerned? No? So right now, there's a push towards better funding for healthcare. That's the whole purpose of the sin tax law, okay, is to provide access to funding for health programs. There is a need for improving equity and access, meaning to say those who need it most and with the least amount of resources need to have better access to available health programs. Of course, the thrust now, and as Shea has mentioned, is primary health care, prevention, rather than waiting for disease to strike. Okay? So primary health care is crucial, and good governance relating to how we manage the limited resources we have. Okay. So what can the private sector, what can we do? What can the private sector do in order to promote better healthcare access? So I think both Jimmy and Shea have aptly demonstrated the commitment of Ayala and the MPIC group, no, in providing very good healthcare. And that's a start. And it is also a responsibility of each of our organizations to be able to do that for our families, the dependents of our families and constituents. But there is also an opportunity to do beyond that and reach the greater community to make access more widespread, no, across the community. We also need to share the strengths of the private sector. Again, the theme is on innovation, digitalization, technology. So it's harnessing that capability of the private sector and sharing that, making that accessible, okay, to both our partners in government, NGOs, and the greater community. And finally, and this is very important, building partnerships, because of the size of this challenge, the only way to make a dent, progress, no, to achieve progress is really through partnerships and collaboration. Right, so I just wanted to share some of the initiatives that we are doing in the group, in the Unilab group, to promote better healthcare access. Okay, so we started the Unilab Center for Health Policy with the whole focus of assisting government and also our stakeholders building partnerships to promote universal health care and better access to health care. Okay. So I'll just share 4 of the key projects that we are working on or have worked on. The first one is this 30-year study, which was done with academe, with the UP School of Economics, to look at how we are spending our resources. So it's an analysis, 30-year analysis of our healthcare spending and what the trends are. Okay, and this is some of the data I've shared with you. This is something we've also shared with the DOH and PhilHealth. The second one is on the area of management of resources on disease-related groups or diagnostic-related groups, which are the cornerstone of universal healthcare. The third is just operationalizing this whole idea of outpatient healthcare under the PhilHealth Consulta program. And the fourth is looking at better access for geographically remote and disadvantaged areas. So the poorest of the poor in the country. Okay, I think these are some initiatives, and it's just a start. It's a drop in a way in this whole massive challenge that we face. But I hope that in a way it also inspires us to explore collaboration opportunities that we can do to promote this, this mission of better healthcare for all. Okay, so thank you very much, and pleasant morning to all.
Thank you very much, Lito Diga, SVP for Finance of Unilab Incorporated. And again, thank you very much to yourself, to Shay and Jimmy for collectively moving the needle in terms of improving better health outcomes for all. Now I invite all the panelists back on stage, including Yusek Molly, for our panel discussion. To moderate the discussion, may I call on the Phoenix Academy Chairman, Mr. Michael Gorin.
So good morning, everyone. Welcome to our first panel discussion. So definitely a very informative and very detailed presentations from all of our panel members. And thank you very much for your presence, Yusek Molly. So just to set the baseline info, I hope everyone's aware when we talk about healthcare, it's really about three main items. Provider group, right? The clinics and the hospitals. Pharma, number two. And then what we've been seeing more of would be digital/technology. So that's especially true for AC Health and Metro Pacific Health Group, as all of you have seen earlier. And then in the area of healthcare, we talk about the 3 A's. It's very similar to what President Jimmy mentioned. Access to healthcare. Can you find a healthcare provider? And then number two, assuming you find him or her, can you afford to pay the service, affordability? And then very similar to your Q, quality, it's A+ service. So assuming you're able to find and you're able to pay, will you get well, right? So those are the three main items. And I think, I'm sure all of us have questions as a result of those presentation decks, so feel free to ask questions. You can always stand anytime. But just to start things off, to Yusek Molly, actually this is related to one of the slides shared by Shay earlier. So for me, having one doctor for every 26,000 Filipinos nationwide, and then one for every 40,000 in rural areas. So my first question, ma'am, is, so that's the current statistic. But comparing that to 5 years ago, to 10 years ago, to the extent that you can provide us your views, no, no right or wrong answer, do you think we've progressed as a nation, or have we officially regressed or, gone down the ranking, so to speak?
Good morning, everyone. Actually, I'm not the USEC for the HRH, but as I can see, there is really an issue with regards to the health workers. And pag nakikita ko po yung data, I think it's more of the nurses that we are lacking off. But when you check on it, kung tama ang memory ko, we have 195,000 nurses all over the country. Registered nurses. But only like a few percentage is into the medical industry or into the health industry. Kaya nagkakaroon ng gap. Kaya pag the Nurses Association ang kakausapin, walang kulang. It's actually meron. But the problem, the nurses that are, who belongs to the 195,000 number is not into the health industry. Kaya nagkakaroon ng gap. But when I reported just recently to the Australia Digital something, I reported that only one across the Philippines ang walang doctors to the barrio. So I think we are improving in terms of the doctors ratio to the patient. Just that, yun ang kaya kong sabihin to my knowledge kasi that's not really under me.
Fair, very fair, Yusek Molly. Thank you for the answer. So maybe address to the rest of our panelists. So definitely using technology in your respective companies, you've increased the level of access by Filipinos to healthcare. But we're sure that you're not yet done, right? You haven't reached the population that you'd want to reach. So starting with you, Jimmy, no? So in terms of the areas, be it geographically or demographically, where would you still want to, dwell into and dive into as far as healthcare is concerned?
Well, in terms of access, definitely the advent of the digital technology or teleconsulting, which has become a very efficient way to reach out to patients, especially during the pandemic, should continue to actually be introduced and expanded across the entire Philippines. The providers also need to continue extending their reach in terms of actual facilities available in many areas around the Philippines. In our case, aside from the clinics and hospitals that we have, we're also serving the corporate market. We actually manage corporate clinics involving at least almost 70 companies, 220 plus of them, which enables us to actually reach out and provide primary care, including referral to for specialty care for all of those employees, thousands of employees. So I think it needs to continue, enabled by technology, definitely, so that we can reach out to more Filipinos out there. And I think the Consulta program of PhilHealth, where we are also an active participant as one of the sandbox participants, also enables us to reach out to many of those communities where we are present to provide access to healthcare. So I think a combination of all of those things need to happen. The other thing that I should mention is private-public partnerships with LGUs is also very important because that's also one way to build or extend healthcare to the communities, not necessarily around us, but even outside of our geographic space. And that's an area as well that we are focusing on at Healthway Medical Network, partnering with LGUs, not only to operate facilities, but even explore programs that will allow us to effectively provide that access.
All right, thank you, Jimmy. Over to you, Shay. Feel free to share.
Siguro for us, I mentioned earlier that we've already provided access and reach to our OFWs in partnership with the Department of Migrant Workers. We're also doing many things in terms of reaching mga IP communities, which we partner with Unilab, and also the remote areas, and then the AFP. What we're also trying to do is to zero in on people or communities that do not have health access. For example, we've partnered with the Department of Justice in terms of providing health access to the prisoners, mga correctional facilities for women. And now we're also talking to schools in partnership with the DepEd, because we want health and wellness awareness to be seeded at the young age, because our health is really from the beginning naman when we're young, etc. And we're doing that on both fronts, on the physical health and also on the mental health.
Over to you, Lito.
I just wanted to add, these are very important points shared by Yusek, Ong, and by Shay and JB. There is a huge mismatch right now between demand and supply and healthcare, and it is a difficult challenge. This shortage of professionals, trained healthcare professionals. They're underserved, the tyranny of distance because of our geography. There's resources, financing for healthcare. All are huge challenges. And right now, as a country, we really have to invest more on primary healthcare. I think that's crucial, because that is the starting point, as you say, Shay. When kids are young, from maternal health care to natal care, all the way to geriatric care. These are all areas of opportunities. And I think a big challenge, and also opportunities for the private sector to look at where we can leverage our knowledge, expertise, technology, access to resources, so to help move that forward. So for me, that's good opportunity. I think digital, for example, can change the economics of how we provide healthcare. So that's certainly one of the things that we really need to harness.
And then, as you can see, majority, maybe over 90% of our audience right now are from corporate, right? We do have a few guests from media and government. So basic question is, we know that technology needs to be an integrated part of management and of the company. So how did you do it, right? So there's always the challenge of having the plan in place and then realizing that plan. So maybe coming from any of our private sector guests, can you share any tips on, assuming you're still on the nascent stage of trying to introduce technology into your own companies, any tips for our audience in relation to technology implementation and hopefully integration into their respective companies? Yeah, go ahead, please, Jimmy.
Well, for the provider space, technology is really very important. Digitalization, if you may call it in a different name. In our case, we're still in the process. We made a very deliberate effort to actually invest in coming up with a unified and integrated electronic medical records, because we believe that that's the way to go, not just to ensure that there's a seamless patient experience, but also to be able to capture all of the medical, data that is available, and integrating the different systems as well to that EMR, the Laboratory Information System, Radiology Information System, ERP, even the PhilHealth, claims is an integral part. And by doing that, we will now be able to draw on significant data that we can actually mine to create insights, use cases in particular that we can actually tap to actually serve more patients for the network. So it's not an easy task. While our hospital group is the one that we actually acquired is just one group, Healthway Qualimed, 4 hospitals and 1 ambulatory surgical center. Even a single company like that has a very diverse set of records that need to be integrated. And if you add the other legacy companies into the picture, you can imagine the amount of work that needs to be done just to clean up, standardize, and integrate the data. But it's something that we need to do. It's something that I think the industry needs to do moving forward, no matter how hard it is, because that's the way to go for us to be able to continue servicing more patients in the best way possible, but at the same time support our growth ambitions. So that's really, I'm sure all of us here are finance practitioners. We've been involved in implementations of big systems. So we all know the challenges that go with that. But you just need to be focused, have a clear plan, and have the right people to actually execute to be able to do it properly.
Over to you, Shay.
So for us, technology is really a tool and an enabler in respect of us being able to achieve our purpose, which for MPIC is to contribute to national progress and uplift the life of the Filipinos and communities we serve. And it's also related to how we do our sustainability agenda, which is really a holistic and an end-to-end approach on EESG. So because I'm also Chief Finance and Sustainability and Risk Officer, we've taken a look at sustainability in 4 aspects: economic, environment, social, and governance. And we have specific KPIs for each EESG. And SGV is the one auditing us now. They know that our bonuses, not just of the top management, but including our employees, are hinged on EESG already. So a portion of our bonuses and incentives are allocated to the achievement of the EESG KPIs, and then we get a bonus, an added bonus if we achieve it. And to have skin in the game, we actually get a minus if we don't achieve it. So it is incumbent upon us to all embrace everything. Kasi para siyang right minus wrong eh. If we don't achieve it, we get a minus. So we don't like that, diba? So that's how we are able to plan and design and embrace everything that we do at MPIC. Yeah.
Would you like to share, Lito?
I just wanted to add also the very good example shared by Shay and Jimmy. Technology is an enabler and a way to transform the way we do business. No? One of the challenges in managing healthcare is information and insighting as a basis for making better decisions. No? So right now, for example, I mean, going back to universal healthcare and making sure we have good primary care. Right now, there's a way for us to collect and process data relating to health behavior and health habits in relation to specific health outcomes, disease-related outcomes and diagnosis and so on. This is very powerful if we can use it properly as a basis for helping us, as you say, drive the right behaviors and also the right policies and practices within organizations and communities. So I think for us, it's really how do we use all of these technologies and work in partnerships to be able to have better insights and achieve better outcomes, no? Which is really all about health at all life stages, no? From youth all the way to senior, being a senior citizen, no? Okay, so I think that's where we can come in.
Thank you, Lito. Yusek Molly?
Yeah, I'd just like to share on part of the government. Kami po dito, as I'm the Chief Information Officer of the DOH right now, we have the strategic plan that would be from next year until 2028. But apparently, ang only problem is when I came in as the CIO, the one that has been submitted to the DBM has already been made. So ang akin lang po is just to double the amount that was submitted by DOH so that the DBM would grant us quite a numerous number of items that would be approved in the ISSP. But now that I am the CIO, we are trying to, how do you call that? We are trying to check on the status of all the softwares or the apps that has been made in DOH na medyo matagal na rin po, na matanda na rin ang mga apps. That's why the collaboration of the government to other government agencies, which is the President is saying the whole of government approach, is the one that's driving or empowering all these government agencies. So pag meron po kaming plano for 2025, may sure na budget. Even hindi siya mabigyan ng buo, at least siguro 1/3 or 1/2 good enough para magawa yung project. And then this is assured for the next 3 years until the end of the term of the President. So parang may magagawa tayo. And that's what's important. And I'd like also to comment on what Sir has been saying, that we are empowering the primary care facilities. This is in connection with the opening of the Bukas centers. The Bukas po is the bagong urgent care and ambulatory services of the DOH. Ang plan po nila, or the vision before I came in, was 28 Bukas centers in 28 provinces for the 28 million Filipinos. That was the goal of the administration, headed by the President and of course our Secretary. But to share, at least to date, I think we have 32 or 34 Bukas centers already. And we are ahead of schedule. Ang Bukas po is like a primary care facility na attached po siya to a DOH hospital. So ang license to operate niya po ay naka-mother dun sa Bukas, sa DOH hospital. And then it divides what is ambulatory, meaning yung check-up, OPD, and those procedures that can go home, para hindi po mahahawa ng sakit yung mga tao to the hospital. Yan po yung gusto ni Secretary, and of course also the President. And we are, I think, we are doing good on it. Tapos din po, as part of the DOH initiative to reach out those provinces na wala pong access to health, we also deployed 80 mobile clinics na meron ding doctors, meron pong may genset na kasama, may internet connection na kasama, so that we will be able to come up with a good access to almost all of the Filipino people. So kung 80 provinces across the nations, ganun din po ang binibigay na namin. The recent that we have deployed ay yung pong sa Mindanao. So that's the last leg. So we're doing good, and the governors are the one receiving it, and the governors will be the one to sustain it as well. So may ginagawa naman po ang gobyerno on this side of the health industry.
Okay.
Thank you.
Thank you for that info, Yusek Molly. Well, sticking to those topics, yung Bukas centers as well as the mobile units, currently are you coordinating with the private sector for ways to, multiply it times 10, right? Those kinds of efforts. Because I'm sure in terms of interest, private sector might be interested, but it's also very consistent with the various aims and missions of the various private companies.
Yes, I believe that we are in constant communications with the private sector, and I attended one PISAC meeting already, and I think it's the secretary who's mostly present. I attended once, and we have aired out all our issues as part of the government, saan po tali ang kamay namin on how to help more. So with the President, I think he would be addressing these things soon, hindi lang po siya mabilis. But right now in DOH, as I am part of it, medyo I came from a DTI attached agency, so medyo iba po yung mindset ko. I'm not the usual, I'm a dentist by profession, by the way, so iba po ang mindset ko because I came from PITC, which is a business and procurement office of the DTI. So gusto natin parang private sector din ang nasa government, mabilis po lahat ng bagay, to think limited ang resources. So that's it po. Thank you.
So just to remind everyone that you can ask questions. So, okay. So, let's take one question from the floor. And then I've been told that we need to wrap up soon. So maybe after this question, once you go through the answers, maybe one final thought from each member of the panel. Thank you. Yes. So kindly mention your name and then ask your question.
Hello, good morning. Hi. I'm teacher Rochelle. Actually, I'm from the education sector, basic education. I'm a school principal of John Dewey School for Children and also the executive director of Partnerships for Sustainability Education. Health is definitely a key issue when it comes to sustainability. Come to think of it, whatever we have been working hard for, all these things will be in vain if our well-being is really compromised. So definitely health should be our primary or priority at the workplace as well. However, I would like to know, because we have been talking about earlier, that true prevention is better than cure. However, we have always been focused more on the cure side. Now, I would like to know, because we are from the education, and definitely when we say prevention, health education is key. Now, I would like to know how you are also doing initiatives in this regard. So for example, just my own observation, even the doctors, well, there are so many documentaries in Netflix already about this. And we know that 70% of our health is really anchored on diet. However, when we're consulting a doctor, for my mom, for example, she's an 84-year-old senior citizen, and the doctors would say, you can eat everything. But my mom has a heart problem. So, so even I think among doctors and medical staff, health education is not so much their expertise, despite that they are in the medical field. So I would just like to know how all of you are really looking into this, and if you're really paying attention, I mean, giving attention, and that means resources coming in to this area. Thank you.
So who would like to take the first stab at that question?
Private sector, ako sasagutan din po.
So for our group, we actually encourage everybody to do physical activities. Like in our office, we have this 30-minute Zumba on a daily basis. We don't change. It's like lunchtime. When we do our meetings, we just stand up and then start dancing, etc. It gives us the positive hormones or the energy to, you know, continue on the daily work in the afternoon. And also encourage our partners to join us. So for example, if you're meeting in our office and you're there, you will have to dance with us. No judgment. So it's something that is fun for us to do. We're really making health and wellness fun, and we're gamifying it also, and incentivizing those people who are healthy in respect of our wellness score. And really, we want to invest in the health of our employees because, again, with employees who are healthy physically and mentally, they're, you know, more productive, and there's really less medical cost for us.
Yeah, and the part of the government naman po. Of course, there is the usual public health programs of the DOH, yung mga immunization natin. Kompleto po yan. And that's one of the 8 outcomes of our secretary, that he want to have the fully immunized child now, kasi po during the pandemic, and because of culture, hindi talaga nagpapabakuna. And that's what they wanted to happen. And of course, the Health Promotion Bureau, meron po tayo niyang bureau sa Department of Health. And now that there's a new director, and I think she is more open to what is supposed to be the essence of the Health Promotion Bureau, gagawin na po rin namin yan na parang there are advertisements, parang walking of 15-minute will burn you or give you like this. So mga ganun pong klase ng information that is supposed to be part of health. So sooner, yan po ay makikita nyo na rin po sa Department of Health.
Thank you. Over to you, Lito.
Yes, I just wanted to address your question. I fully agree that health is one of the cornerstones of sustainability for society as well. No, so I just wanted to share for the Unilab group, the children's and women's health is core, one of the core areas of focus for the group. And so the thrust, as you say, should be in several fronts. Now, on one hand, it's MD education. Admittedly, a lot of the MD education right now is focused on curative. You come to me because you're sick, so I'm gonna find a cure for you or look for the best solution for your problem, rather than preventive, as example is the experience you've had with your mom. So I think part of that is working with the medical societies and medical doctors to change mindset. So it's not a matter of curing the patient, but how do we actually prevent health issues, no, from an early age, no? And so that includes also working with patient groups, consumers, no, the importance of proper nutrition, proper preventive health care like vaccinations, which some mom. I think the key here is working with mothers, because generally in families, it's the mom who drives healthcare behavior. Doc Ong, you might agree, no, about that. So it's really working with moms, no, to look at health as a priority for the family and what can we do to prevent illness, no, and it's also part of educating ourselves, no, as empowering ourselves, not just as patients, no, but as taking charge of our own health, no, and doing something to make our whole families better, no. So.
Right. Thank you, Lito, and then Jimmy.
Yeah, in our case, we definitely agree with you that health education is critical, because a lot of the illnesses can be prevented by actually educating everybody. You know? In our case, at Healthway Medical Network, we actually have different groups that we actually touch effectively. Starting from our own company, we actually have regular health and wellness webinars, no, or hybrid seminars, not just for the employees themselves, which is very important, supplemented by, of course, activities that promote health and wellness, but even the doctors, because the doctors, as you said, a lot of them actually are not fit, no, technically, because ayaw nila, no, they choose to actually pursue the lifestyle. So it pays to actually remind them and make them part of the advocacy or the target group. So that's our own employees and doctor pool. Next one is through our corporate clients, no, where we have thousands of employees that we serve through the different corporate clinics that we handle or that we manage. It's really part and parcel of the service that we provide, aside from managing the clinic, effectively assigning a nurse and a doctor to take care of their needs and providing medicines as necessary. We also come up with health and wellness seminars, no? Aligned most of the time to the monthly theme of health and wellness. Like this month is Breast Cancer Awareness Month, October. So it's important that we also cover that constituency to promote health awareness among the corporate clients. Another group that we also coordinate with or partner with are the patient access or patient advocacy groups. We are in partnership with organizations such as the PAPO, Patient Organization of the Philippines, I Can Serve, and other cancer-related and non-cancer-related organizations. And part of that MOA that we actually signed with them is really to provide this kind of service to their constituents, no? Their cancer survivors or those who actually just want to get more knowledge in terms of how to be well, no, as an individual. And then the other group that we also address are the communities which we serve. And either we partner with the villages, where we actually play an active role. We do on-site examinations, laboratory, vaccination, even we bring actually even beds, no, to the villages to do pap smear, ECG, etc., X-ray, and part of that is really also educating them. The individual villages or communities where we're located, and at the same time partnering with the LGUs where we operate to extend this kind of program again to their constituencies. And this is really intended to enable, to actually empower them to take charge of their health eventually. Awareness, it starts with awareness, which is preventive rather than curative. And that's really the kind of thrust that we're pursuing to actually supplement the actual provision of care that we do, starting from the basics of understanding health as a concern, no, that they should manage.
Thank you, Jimmy. So, as mentioned, we need to wrap up, but just to give due recognition to your time this morning, well, afternoon, may I ask one closing words from each of you? 1 minute or less. Keep it as concise as possible. So, ladies first, Yusek Molly.
The only thing that I can say is that the DOH now is your partner in health services. We have limited resources, but with us around, with SEC and I around, the only thing that I can commit is we will make sure that the funds that allocated to DOH will be used for the access of health to the different Filipino people across the nations. Kasi po may budget. I'm also the head of HFEP, so I wanted to make use of these funds na ang government hospitals ay as good as the private ones in terms of equipment. Dahil po with the consulta package of the PhilHealth, you will be seeing more of the dental package to be part of it. As I am a dentist, I am promoting my profession, of course, and this has been the usual comments of the senators that overall, may brain, may mata, may ilong, but the mouth is being neglected. So I urge also the private sectors na bigyan din ng tuon itong ating oral health because we want to promote nutrition, but when you analyze the equation, with nutrition, kasama po talaga yung oral eh. Pag pangit po ang ating oral health, we will not be able to chew, we will not have the gana to eat. So I urge the private sector also to take a look into the oral health at wag natin pong tipirin. Kasi nagugulat ako pag nakikita ko yung procurement namin, ha? Ganyan lang ang amount. Ikaw ba papayag ka na ganyan ang amount that you will be putting into your mouth that will be good for a year? When I was practicing as a dentist, I want to share, paggagastos po ang pasyente ko ng, let's say, 100,000 for a procedure. 100,000 divided by 5. So that's only 20,000 a year. 20,000 divided by 12. So that's the only thing that you are allocating for your mouth. And ang hirap po. Kung wala kayong bibig, nakapustiso, ang hirap magsalita, ang hirap kumanta, di ba? Parang all of these things will not be into reality kapag po wala yung bibig. And it's very frustrating na ang tao po sa Philippines is not much of the oral health. That's why ako po ang isa sa nangungulit sa PhilHealth people to encourage na magkaroon ng oral package for the dentist and at the same time to be approved, of course, by the board of PhilHealth. Kasi ang PhilHealth po is governed by a board. And not only that, we will be soon accrediting dental facilities in the DOH kasi wala pong standards. Turned out, walang standards ang dental facilities sa DOH. So we're trying to put all of this in place habang nandito po ako. And this is one of my concerns really. And just the same, kung meron po kayong gustong ipasama as part of the packages in the DOH, I am always free to listen.
Thank you.
Salamat po.
Thank you, Yusek Molly. Shay?
Siguro for me, health should be everybody's priority. So we all need to invest in our own health, invest in our family's health because we love them, and invest in our country's health. In respect of the sustainability link naman of health, we know it's very, very clear, right? And because health is a basic right, on the social front, we need to take care of each other in terms of our healthcare requirements, because we are stewards of each other as people.
Thank you, Shay. Lito?
So the theme of FINEX this year is empowering progress, inspire change. So we all agree health is important. It is a huge challenge, but also a big opportunity. So I think I just wanted to say it starts with us. So what are we willing to do? And there's so many things that I think FINEX and this group can accomplish. Okay, but it means that we have to work together, because the challenge is not something that any one company or any one organization can handle alone. But I think with better collaboration, exchange, and harnessing our expertise and talents, there's so many things that we can do. Okay. So yeah, just wanted to share that.
Thank you, Lito. And then Jimmy?
I echo Lito's statement. Health is a basic right. It's, I think, number 3 or number 4 in the Sustainability Development Goals of the United Nations. And providing access to health services is also one of the key elements of the, I guess, social determinants of health, which is a WHO, based on the WHO study. And I think a lot of the things that we will be discussing earlier in the next discussions on education, employment, etc., are all aligned with the social determinants of health, which all effectively work together in terms of ensuring that a country like us actually continues to grow as a nation. So we at AC Health, together with our private sector partners and I guess and government as well, no? Private sector and government partners are committed to actually delivering healthcare to as many Filipinos as possible. And but we need everybody's support to be able to do that. And it starts with education, which is a basic right, and then we can go from there, partnering with the government in terms of the Universal Health Care Law. UHC is an important component to deliver primary health, to effectively reduce the burden on the industry, which currently is also experiencing a lot of challenges because of the availability of manpower, access to health financing, and even medicine affordability. So it's everybody's concern, so let's all work together to ensure that we provide health care to as many Filipinos as possible. Thank you.
Nicely said, Jimmy. So thank you, Jimmy, Yusek Molly, Shay, and Lito. Thank you for your time, and let's give them a warm round of applause, please.
Well done, panelists. Thank you again, Yusek Molly, Jimmy, Shay, Lito, and of course, Mike, for a very robust discussion. Not only have you mapped out the rapidly changing landscape of the healthcare sector, you've also identified opportunities for innovation and public-private partnerships to solve these pain points for good. And to borrow a quote from J.R. Tolkien, you're always going to be looking for the one ring platform and app to heal them all. Thank you very much for this panel. Now, the beautiful thing about the FINEX group is we're going to award our panelists here. First, I'm going to call on FINEX President Toti Bengzon, FINEX Week Committee Officers Minion Ramos, Kai Reyes, and Riza Latorre. As I come up, we're pleased to share that the committee officers have curated a healthy and hearty lunch for all of you. Appetizers, I know, are now being served, so please enjoy your lunch, and we shall see each other at 1 p.m. Let's give a round of applause again for our panelists and our speakers and the leadership of FINEX.